So I will talk about introduction, death rate in each country. The death rate varies across Southeast Asia. Malaysia records about 5.6% death per 1,000 people, showing a relatively low mortality rate compared to its neighbors. Indonesia has around 7.5% death per 1,000 people, indicating a moderate rate, while Thailand records the highest among the three at 8.5% death per 1,000 people, reflecting its aging population and demographic change. Hi everyone, my name is Muhammad Izwan Shamil bin Razif, metric number 17DSB23F1043. So today I am going to present a bar graph that shows the number of deaths in Indonesia from 2014 and 2018. As we can see, the horizontal axis represents the years starting from 2014 on the left and ending with 2018 on the right. The vertical axis indicates the number of deaths measured in thousands. In 2014, the total number of deaths was a little above 300. These numbers increased slightly over the next 2 years, with both 2015 and 2016 recording numbers around 350. However, in 2017, there was a significant rise in the number of deaths, reaching about 410. The most noticeable increase happened in 2018, with the number of deaths almost reaching 500, which is the highest over the 5 years period. Okay, next I will present the comparison of this bar graph. The bar graph showing the number of death rates in Indonesia from 2014 to 2018. It can be observed that the death rate in 2018 recorded the highest value among all years. This indicates a slight but significant increase compared to 2014, showing that the mortality rate has risen over time, although not drastically. From 2014 to 2016, the number of deaths remained relatively stable, with only marginal fluctuations ranging between 331 and 350 per 1,000 population. This suggests that during this period, the country experienced a steady mortality trend with minimal variation. In conclusion, the bar graph highlights a continuous and sharp increase in the number of deaths in Indonesia from 2014 to 2018, with the most dramatic rise between 2017 and 2018. Next, I would like to introduce a line graph that illustrates death statistics based on different causes. The graph provides a visual representation of how various types of death contribute to overall statistics. Along horizontal axis, you will find the categories for types of death, which include murder or homicide, road accident, bullying, influenza or pneumonia, and food poisoning. On the vertical axis, the graph displays the death statistic showing how many deaths occurred for each category. Line graphs like this one are especially useful for highlighting trends and differences. Each point on the graph marks the number of deaths for a specific category, and the line connects these points to help us easily see the height and lows across the various types. So next, I will talk about comparison in this line chart. So the first one is road accident. Road accident have the greatest impact on total death, with numbers increasing drastically and dramatically compared to other causes. Deaths death from road accidents rise steeply, significantly higher than any other cause, showing a vast margin in contribution to mortality statistics. This category climbs sharply and contributes a great deal more to total death than others. So the second one is influenza and pneumonia. Influenza and pneumonia rank considerably lower than road accident but still increase moderately, recording higher death counts than murder or homicide, bullying, and food poisoning. These illnesses show a steady, significant impact on mortality rates. So the third one is bullying. Bullying shows only a slight increase compared to food poisoning, indicating a small upward movement in death counts. Its impact is minimal compared to major causes. So the fourth is influenza. The fourth is murder and homicide and food poisoning. Murder or homicide and food poisoning different marginally or fractionally, showing only slight or small variation in death statistics. So overall, road accidents lead by a drastic and sharply margin, while other causes display only slight or marginally differences in comparison. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Israel Shardin. Today I will present about the annual death number in Malaysia from 2014 to 2018. This chart illustrates the yearly number of deaths over a 5-year period, showing a clear and continuous upward trend. Firstly, let's focus on the overall trend. From the chart, it is evident that the number of deaths in Malaysia increased steadily each year. The use of distinct color helps us see this progression clearly. Light blue for 2014, aqua blue for 2015, medium blue for 2016, and dark blue for 2017, and purple for 2018. Secondly, looking the highest and lowest record, the lowest number of deaths occurred in 2014 with approximately 3 units, with the highest was recorded in 2018 with about 9 units. This shows a notable growth over the 5 years. Next, thirdly, let's make some comparative observation. The number of deaths in Malaysia increased significantly from 2014 to 2016, showing the strong and steadily upward movement. Between 2016 and 2017, the numbers rose slightly, but in 2018, it grew dramatically, marking the highest point of the period. Overall, the death rate rose a great deal across the 5 years, indicating a considerable and drastic increase from start to end. In conclusion, the data reflect a consistent rise in annual death in Malaysia between 2014 and 2018. The growth rate was most prominent in early years, slow slightly around 2017 and then increased sharply again in 2018. This overall trend may be influenced by factors such as population growth and aging population or health-related issue that affect mortality. For the next pie chart, 5 main causes of death in Malaysia: COVID-19, road accidents, murder, HIV, and Aedes fever. Each segment shows the percentage contribution of each cause to the total number of deaths. First of all, COVID-19 is the most dominant cause, accounting for 41.7% of the total of death. The number of deaths due to COVID-19 increased drastically and dramatically during the pandemic years. It affected the population a great deal, showing how serious the outbreak was for the country health system. Next, road accidents contribute 20.8%, which is considerably lower than COVID-19, but still significantly higher than the other case. This shows that road safety continues to be a major concern in Malaysia, and strict traffic enforcement could help reduce this number subsequently. And then, murder case represent 16.7%, although not as high as road accidents. This figure is still much higher compared to Aedes fever. It highlights the need for stronger crime prevent and community safety initiatives. Next, HIV with 12.5% has decreased slightly in recent years due to better access to treatment and awareness programs. However, prevention and education effort must continue to ensure the numbers drop even more in the future. Finally, Aedes fever contribute only 8.3%, which is fractionally and marginally small compared to the other case. Even though the percentage is low, it remains an important issue as dengue is preventable disease that can still claim life if not controlled properly. When comparing all these cases, COVID-19 stands out dramatically as a major contributor, while Aedes fever has the least impact. The rest, road accident and murder and HIV also fall somewhere in between, each affecting the population to considerable extent. In conclusion, this chart shows the Malaysia face a wide range of health and safety challenge. To reduce this death significantly, we must improve public health awareness and strengthen road safety and promote preventive measure against the infectious disease. Thank you.
Good day everyone. My name is Muhammad Taufik Asmawi bin Azhar and my nominated is 17 DSB 33F1045, and today I am presenting about the group death rate in Thailand from 2014 to 2018. This analysis will help us understand the country mortality patterns and the factor influencing these trends. So the features of the data is this line graph cover the mortality rates in Thailand over a 5 years period from 2014 to 2018. The independent variable is the year and the dependent variable is the death rate to 1,000 population. By analyzing this, we can observe both overall and specific causes of death as well as changes by age group if more data is available. So overall trends during this period, the death rate in Thailand increased gradually from 7.33 per 1,000 in 2014 to 7.67 per 1,000 in 2018. This reflects a consistent upward movement, suggesting shifts in health or demographic factors. So there are three comparisons. So the death rate in Thailand increased gradually from 7.33 per 1,000 people in 2014 to 7.67 per 1,000 people in 2018. And the second is from 2014 to 2018, the death rate increased steadily in Thailand showing a consistent upward movement over this year. And the third one is the death rate rocketed between 2016 and 2018 as the increase become more pronounced compared to the earlier years. So the conclusion is Thailand mortality rate show a slow but steady increase over this period. Minor fluctuation were observed, but the trend largely reflect changing health conditions or population dynamics. Continued monitoring is essential to track future development and guide public health intervention. Next, I will present on the type and causes of death in Thailand, using clear data visualization to highlight key patterns and public health priorities. So the chart features this chart employs horizontal bars to represent 5 major causes of death: circulatory system disease, respiratory system conditions, infectious diseases, accident, and cancer. Each causes is easily distinguishable by color, and the exact death toll is shown beside each bar. This allows for straightforward comparison across categories. So the variable and trends, the main variable in this chart are categorical causes of death and numerical. The number of the death, we can see that both circulatory system disease and cancer emerged as the leading causes, each with over 80,000 deaths. Other causes like respiratory disease, accident, and infectious disease show significantly lower figures, each below 50,000. So there are 3 comparisons. So the first one is the number of death causes for circulatory system disease was dramatically higher than all other causes. It can be seen that there were 84,904 deaths from the circulatory system, while cancer, which ranked second, recorded 83,334 deaths, and other causes show much lower value. There is sharp drop from circulatory system to respiratory system death, with a difference of 35,836. So the second one is the number of death from respiratory system conditions was considerably lower than those from the circulatory system and cancer. It can be seen that only 49,068 deaths were attributed to respiratory issues, compared to more than 80,000 deaths each from circulatory system and cancer. So the third one is death from infection disease were relatively lower than death from accident-related causes. Specifically, there were 39,903 deaths due to infectious disease, while accident-related deaths reached 41,480, showing the accident subsequently exceeded infectious disease by a small margin. So the conclusion is the data reveals the circulatory system disease and cancer are the most frequent causes of death in Thailand, by a substantial margin, while other causes account for far fewer deaths. Their findings highlight need for health intervention to prioritize circulatory and cancer-related conditions to reduce overall mortality rates. So that's all.
Okay, next for the conclusion, the death rate in Malaysia, Indonesia, and Thailand show a different patterns depend on the cause of death. In three countries, road accidents record the highest number of death making. A major public safety concern that requires attention. Disease such as influenza and pneumonia also contribute significantly to total death, highlight the importance of healthcare systems and preventive measure. Meanwhile, murder, bully, and food poisoning account for the fewer deaths, indicating that these factors have a smaller impact compared to accident and illness. The difference in death rates among the three countries reflect variations in infrastructure, public safety awareness, healthcare quality, and socio-economic factors that influence public health. Overall, the data emphasize that road accidents and disease remain the leading cause of death and require serious attention through policy interventions, public education, and healthcare improvement. Thank you. That's all from us.